Hi everybody, it's Adam with HeartValveSurgery.com, and we are at Cedars-Sinai Medical Center in Los Angeles, California. I am thrilled to be joined by Dr. Dominic Emerson, who is the director of robotic cardiac surgery. Dr. Emerson, it is great to see you again, and thanks so much for being with me today.
So happy to be here.
Yeah, so Dr. Emerson, one of your specialties is mitral valve surgery. We've got a lot of mitral valve patients in our community watching this video right now. The question that I have for you is, given all that you know about mitral valve repair and replacement, how would you choose a mitral valve surgery program?
I think that's a great question, and it's actually not an easy one to answer. There's a lot of different factors that go into it. You know, choosing a mitral valve program, I think, depends not only on your surgeon, but on the institution and the team as a whole. You want to go to a place that you're going to be comfortable with, and with providers that are going to be able to take really good care of you as a whole person. And that can take a lot of different forms depending on what exactly the pathology that you're treating is. One of the things that we know really specific to the mitral valve is that a good repair is vastly better than any replacement you could ever have. And so I think that's very important to think of when you're choosing a center. You want to go to a center that has a good track record of providing high quality repairs, and the repair rate is very high. The centers of excellence that are out there, and mitral reference centers, which is a designation that's given to about 25 centers in the US, Cedars being one of them, indicates that those centers have at least a 95% chance of repair for patients with degenerative mitral valve disease. And I think that's a good marker of really a successful program. That doesn't mean that you have to travel, a huge amount of distance potentially, and I think that it is important to weigh the distance from your family and from your normal surroundings to a center. And one other thing that I would think of would be the approach. As a robotic cardiac surgeon, I'm obviously very invested in that technology, and I think that robotic cardiac surgery not only provides you as a surgeon with an ability to treat the valve better. I think there are better repair rates with robotic cardiac surgery, but also it's a little bit faster recovery. I think it's a smaller incision, a little easier on the patient. And so that would factor heavily into where I would choose to go have my valve done. Now, that is a limited technology. Not everybody's doing robotic mitral valve repair. Maybe 100 centers in the US are doing it currently. But I think because of the advantages that offers, I think that would definitely factor into my decision making.
Yeah, well, Dr. Emerson, on behalf of the patients in our community, those specifically with mitral valve disease, thank you for sharing your insights specific to how you would select a mitral valve program to treat your disease. And on behalf of everybody at HeartValveSurgery.com, thanks for everything you and your team are doing here at Cedars-Sinai.
Thanks so much.
Hi everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.